Okay, looks like we are live. Hey, everybody, welcome. It's so great to have you on. Okay, welcome everybody. We are going live today. My name is Lakshmi. I'm an organizer with Hoosier Action in Jackson County, and I'm here with Hoosier Action member leaders. And we're going live today to share stories and experiences, our stories and experiences of the healthcare crisis in our state. And this is a part of a day of action that we are doing. We are texting people, peer-to-peer texting people across the state today, and asking people to join us in taking action to protect our healthcare and expand access to healthcare in Indiana. So I'm super excited to be here with all of our member leaders here. And we will get to introducing ourselves in a minute. So whether we are from Gary or Georgetown, wherever we're from, whatever is in our wallets, no matter where we live, we all want to be able to access the healthcare that we need and be able to afford the care that we need in our lives. And for too long, big insurance corporations like Anthem have turned our health and lives into products for sale and have been raking in massive profits doing so. And right now, they are spending millions of dollars to lobby against policies that would lower healthcare costs and support Hoosier families. So that is why we are on here today. Access to healthcare people were already struggling to access healthcare before COVID, and since COVID has hit, it has only gotten worse. And we could be getting relief through a set of policies right now, but Anthem is getting in the way of that because they are blocking policy that would expand Medicaid and Medicare in Indiana and lower prescription drug prices. So this is really a moment for all of us to stand together across all of our differences and join together to demand that Anthem live up to its Hoosier values by seizing their efforts to block policies proven to lower healthcare costs, expand care, and improve lives of Hoosier families. Okay, so I'm gonna go ahead and give folks a chance to introduce themselves. So everybody, if you wanna say your name, where you're calling in from, and one sentence about why you're here, that would be awesome. And Caitlin, do you want to start us off?
Sure. So I'm Caitlin. I am calling in from Goshen today, and I am here because I think this is something that everyone could benefit from if we're successful.
Awesome. Cody.
Hello, I'm Cody. I'm from Columbus, Indiana, and I am here today because I currently struggle with the healthcare crisis, and I'm behind it 100% for Hoosiers to gain more access to the care they need.
Myra.
Hi, I'm Myra from New Albany, Indiana, and I believe that having affordable quality healthcare is a right, not a privilege for all Hoosiers.
Awesome. Thank you all for being on. And again, my name is Lakshmi, and I am the organizer with Hoosier Action in Jackson County. So the price of healthcare impacts all of us in different ways. And if you're watching this from your home on Facebook Live, please join in the comments and tell us why you're here, where you're calling in from, and what your story is. And like I said, the price of healthcare affects all of us, and all of us have a story around this. And for some of us, it's about the reality of medical debt and having to think about that every single day. And for other people, it's about wondering if you can go to the doctor if you get sick. And for others of us, it's about worrying about the people that we love. I have family members with chronic pain and illnesses that won't go to the doctor because they don't believe that their pain is worth the high cost that it would take to take care of it. And just recently, even a few weeks ago, I found myself debating if the pain that I was having in my back was bad enough to see a doctor. And I ended up going to urgent care and paying $75 copay despite having insurance, and found out that I had a kidney infection that I had to treat. So this is really something that affects every single one of us and affects our decision-making around healthcare as well. And we are going to share, Cody, Caitlin, and Myra are going to share some of their stories around healthcare as well. And please put what you've struggled with in the comments. So last year was one of the hardest years in living memory for so many people across the state. And Anthem has been racking up massive profits. Their significant share, they have 60% of Indiana's health insurance, both public and private, and their significant share contributes to the extremely high healthcare costs for Hoosiers, and their blocking of these provisions, these policies, will continue to fuel the medical debt crisis in our state. So 19% of Hoosiers, that's 1 in 5 almost Hoosiers, have medical debts that are turned over to collectors right now, and that is not okay. So we're here to share our stories. I'm gonna hand it over to Caitlin to start us off. Caitlin?
All right, so again, my name is Caitlin. I'm a leader with Moms of Hoosier Action, and the cost of healthcare has affected me during my pregnancy. Last year, I got married, and my husband and I have always talked about having kids. We didn't want to wait very long, and he already had a son, so we were really excited to add to our family. So pretty early on, I had some concerns, and I ended up getting an ultrasound when I was about 6 weeks along. It was my first time being pregnant, so I absolutely wanted to get those concerns checked out. And then I got the bill, and it was over $300. So after that, it really changed how I thought about looking into medical care. If I was worried, I wondered, what point do I really need to go seek that care? At what point do I stop convincing myself I'm overthinking and that something could actually be wrong? I was also surprised to find out, I got a private ultrasound to find out the sex of the baby, and that was under $100. And that was a much more high quality experience than what I had experienced at a medical facility. So looking ahead, the cost of medical care is just kind of a dark cloud over the pregnancy. I know I have a partially unpaid leave coming up. I'll have the cost of delivery, my hospital stay, and then I'll also have those childcare costs once I return to work. So adding the cost of medical care is really a lot to look forward. And then especially thinking about the life I want to provide for my kids and the cost, how every dollar takes away from something else I could provide for them. And I'm very fortunate. I've had a pretty low risk pregnancy, but I believe that if we can strengthen our families by eliminating this worry of medical debt and the costs, that Indiana families can strive more as a whole.
Thank you so much, Caitlin, for sharing. That is so real. And it is the experience of so many people in the state. I want to ask all of you watching, has health insurance gotten in the way of seeing a doctor before and getting care? Share that in the comments. And if we have time, we'll read some of them out loud later on. Thank you, Caitlin. I'm going to pass it over now to Cody, who is calling in from Columbus to share his story.
Right. Hello, my name is Cody, and I'm a member of Hoosier Action. I'm from Columbus, Indiana, and I would like to share my story of not having access to healthcare and how it's impacted me and my family. In 2008, I was involved in a traumatic brain injury and didn't really get the diagnosis until 2020. I also live with post-traumatic epilepsy. So it's been a struggle to be treated for either the symptoms or the actual diagnosis of a brain injury. Getting that treatment from a specialist here in Indiana is not covered by my insurance, unfortunately. And I had to walk up the steps out here in Columbus, Indiana at City Hall and walk into the Human Rights Commission and ask them to back me stand behind me and ask them to provide help or assistance or a meeting with someone who could help me to get that assistance, just with a brain injury support system or the one here in Indiana. So that happened, and I was able to get the support I needed with the help of the Human Rights Commission. And but like it's taken a lot of strength. So I think the injury has given me strength in a way, but it also, I haven't had access to the care I need. You know, like if we look at servicemen and women in our country and how TBI relates to them, it's a very scary fact that every 22 seconds, something extreme could happen like this for the people that serve our country day in and day out and who have served our country. So right now during the pandemic, I've been able to get the help I need through the brain injury like support programs. And I got a diagnosis which gave me validation of my brain injury. And I'm gonna keep chugging along, but everything's not okay yet. I still haven't received the care I need. So health impacts all of us here in Indiana, not just myself. This injury has affected my whole family and my community. And when I get on the other side of this injury, or feel like I'm better, whatever that means, I just hope that there's access to this type of care for other Hoosiers in our state. And we deserve the access to the care. And I just hope for change. Thank you for letting me share that.
Thank you, Cody. That is so real. We do all deserve access to care. You're absolutely right. I'm so glad you're on here with us today.
Thank you.
Yeah. Folks watching the Facebook Live, like I'm curious to hear about also if you have, no one should have to fight for crumbs and fight for getting care, but have you ever had the experience of being denied care, having to fight for it? Share in the comments. And let's share in the comments if you've had the experience. I want to take a second to just share some of the things that people have put in the comments. Thomas says that he is one of the many people in our country currently living without any health insurance. And he says, if everyone has healthcare, employers can't trap people in exploitative jobs using threats of losing healthcare. He says, I'm fortunate that the lack of healthcare isn't a death sentence yet, but that's not true of everybody. That is so real. Tracy says, I put off going to the doctor a couple of years ago because of concerns about costs. I ended up in pain for weeks before finally seeing a doctor. Lane shares, being a college student, but with my parents' insurance, I still skipped needed medical visits many times. I knew I could not afford the copays or medicines. School, life, and family were important, and I gave that my time. I couldn't afford the time to work through the medical bureaucracy, even beyond the financial burden. And Charlotte shares that she has Anthem for her health insurance, and she recently had an eye exam, and one eye is better and the other has gotten extremely worse. Anthem will only give us $75 toward lenses and frames. The lenses alone are $155 to over $200 to get the glasses that are needed. They used to cover it all, but it was changed in April of this year. Yes, vision and dental care are also so important. I know I've gone to the dentist and maxed out on my health insurance when I needed to get important procedures done. And that is really important. Michelle shares, I had to fight for my diagnostic tests prescribed by my doctor, but denied by my insurance company. My doctor said this was a normal procedure and so much so they actually hired a third party to navigate health insurance approvals. My money goes to these middlemen, not the actual doctors and nurses providing care. Yes. Thank you, all of you, for sharing in the comments. Keep putting what you've experienced and struggled with on the Facebook Live. So many times we believe that, you know, we are alone in our experiences and they're only our problem. But as you all can see, this is really a systemic problem, and it's about corporations like Anthem getting in the way of us being able to have the healthcare that we need. I'm going to pass it over to Myra now, who is going to share a little bit about her story and tell us how we're taking action today.
Hi, everybody. I have a chronic condition called lymphedema in both of my legs, and the condition leads to a buildup of lymph fluid when the lymphatic system is either faulty or damaged. In my case, faulty. No cure exists, but it can be treated and maintained with therapy, including bandaging, massage, and compression garments. And these compression garments are usually custom made, and they can be up to $1,000. Most insurance company policies do not cover the garments or the massage. We need Anthem and other insurance companies to cover the cost of the treatment for lymphedema. In the long run, it saves them money. If left untreated, lymphedema can lead to cellulitis and infections requiring long hospital stays. And that's so true of other diseases as well. If you maintain it, then it doesn't get so bad. There are many Hoosiers that suffer with other chronic diseases that require continuous care and treatment. So I'm asking you all to sign our petition today. The link should be in the chat. And we're also having a texting party. We want to reach 150,000 Hoosiers. Let's get Anthem to stop lobbying against lower healthcare costs for all Hoosiers. And I want to thank you personally for attending our Facebook Live today.
Thank you, Myra. And Myra, I'm curious, like, what's it been like for you to not be able to access the care that you need for this chronic condition?
Well, you know, I feel like that my quality of life is not what it could be. You know, 10 years ago, before 10 years ago, I was a competitive tennis player, and I love to go hiking in the woods, and I can't do those activities anymore. So, you know, it makes me sad. But yeah, it's just, you know, you have to go longer, wear the garments longer instead of getting new ones because they wear out.
Yeah.
Yeah.
Yeah. Thank you for sharing. We all deserve lives of dignity, health, and opportunity. And right now, we're not getting that because of what's happening in our state. So like Myra said, we are taking action today. So all day today, our member leaders are texting people across the state. So we've set the very lofty goal of texting 150,000 people across our state to talk to them peer-to-peer and engage them in what their experiences have been like and get them to stand with us and sign this petition to ask, to demand that Anthem cease lobbying against these policies that will lower healthcare costs and expand coverage. So it's super exciting. People are going to put the link to the petition in the comments. So go ahead and go sign that yourself. And then you can also register to join us at any time today, but especially during our power party, which is going to be at 6 p.m. tonight. We'll have a training on how to peer-to-peer text, and we can talk to many, many people across the state in just a matter of a few hours. So let's go get it done. So glad to have all of you here to share your experiences. What you've shared here today is so felt, deeply felt, widely felt by so many people in this state. And it's really important that we come together and stand together in this moment. So thank you again. And I hope to see you at one of our texting shifts and at our power party tonight. Bye.